Hi, this is Anton Fakhouri. I would like to talk to you about compartment syndrome and the technique of measuring compartments for interstitial pressure measurements. What we have in our emergency room is the Stryker instrument. This is our favorite way of doing pressure measurements. The first thing you want to do is make sure that the battery works. You turn it on and you'll see that there's a 00. And then there's a package here that has saline as well as the connections to the transducer. So what we normally need to do is simply open it, connect the saline, and insert it onto the device, as well as the needle to the transducer. Then simply close it, and then what you want to do is zero it at the point where you're about to do the pressure measurements, and you want to make sure there's no air in the system. So you saw a few droplets there, and then you're ready to measure. Again, zero it right before you measure it. There are 4 compartments in the leg, and at this point we're going to measure the 2 most important compartments of the leg, the anterior compartment and the deep posterior compartment. And I would like to just draw this to demonstrate the compartments we'll be measuring on this young lady. She has subacute compartment syndrome, and we will do interstitial pressure measurements on 2 compartments. This is the tibia, this is the fibula, and this is the interosseous membrane, and this is the anterior compartment, and then this is the lateral compartment and the 2 posterior compartment. This is the deep posterior compartment, and this is the superficial. So what we'll do is we're going to feel the tibia here, which is superficial, easily palpated, and we're going to stick our needle anteriorly and for the anterior compartment, and deeper for the deep posterior compartment on the medial side. And so to demonstrate, here's the borders of the tibia, and this is the anterior compartment. This is where we're going to go for the anterior, and this is the edge of the tibia, and this is where we're going to go for the deep posterior. Similarly here, you can palpate the tibia. This is the anterior compartment, and it's again tibia, and then it's become soft again, and about a finger breadth more medial and posterior. This is where we're going to go for the deep posterior compartment. Okay, lay down, please. All right. Again, we're going to zero it. Make sure there's no air in the system.
Take it away.
And we're going to do the anterior compartment. We're ready to put some lidocaine. And inject.
Some labor breathing. No, it's just hurt, like rebound hurting.
And we got about in the upper 30s to, and this is the deep posterior compartment in the left leg, and it's also in the 30s, it's 35. Make sure that there's no air in the system. Wow, that is high. Yeah, it's 70.
Sorry.
And that's, again, here's the edge of the tibia. And inject about half cc of fluid, and we see it's in 38. And this is the deep posterior compartment. Again, here's the edge of the tibia going to the deep posterior compartment, and it's 35. So